Good morning, everybody. I'm Scott Ebner. I'm the Executive Director of Onondaga Case Management Services in Syracuse, New York. We're a lead health home in New York State, which means that we coordinate care management across 8 counties in upstate New York. And we're also a care management provider to approximately 2,000 people at any one period of time in Onondaga County itself. We've been doing care management or case management as it used to be called since the late 80s. So we've been around a long time. We're actually in the process of rebranding ourselves currently, and if anyone's been through that process, you know how painful that can be. We've been dedicated to kind of person-centeredness and motivational approaches and incorporating really technology to really support our mobile workforce, which is in the field. We're a community-based program. The people who work for us, the care managers who are partnering with people in the community, are not in the office. They're out there every day in people's homes, working with people and connecting with people. And engagement is a really important piece of that because those people that we serve are often the hardest to engage in services. So they're the folks that are commonly referred to as that 20% who drive 80% of the cost of healthcare. So when we had the opportunity to partner with iVEDiX, a couple things became really clear as we were talking about what we might do. And interestingly, I think the conversation about whether the technology is mature enough, whether it will work, whether it can connect to our systems, those conversations were kind of put aside very quickly. It was very clear that we could do anything we wanted to do. The question became, will people, our care managers in particular, as well as the people who receive services at our agency, will they use it? So we can create great tools, but will people actually adopt those, especially the people who are in the field and for whom technology perhaps is a barrier sometimes and not necessarily a support. So we were really interested in looking at how can we use and kind of capitalize on what is very mature technology around business intelligence and dashboarding and those kinds of things, and use that directly between a care manager and the person receiving services to help feed information directly to them about the kinds of things that they're interested in working on. So it's like a dashboard for the person. So right now we have a lot of kinds of technologies out there that are intending to engage people, whether they're engaging people in a particular treatment modality, let's say diabetes care, as we heard this morning, and those things are great, but sometimes limited to that kind of one area. Or our other patient engagement technologies are more about reminding people of appointments and those kinds of things. When we think of engagement, we think all healthcare is behavioral, and we're connecting with people to be part of the process and empowering them to take over and be a part of their care planning process, as well as connecting and engaging them with that process. So what we decided to do was kind of jump over all of the things that normally we might do, create a dashboard, build information for care managers to see, and focus on a process or a pilot that would give care managers the opportunity to use data that we would feed that the person can also use. So a very collaborative process to create priorities around care planning so that they could look at the things, the sentinel events, which is as well as the positive events that have happened to them over a period of time, and then use that to develop a care plan that they're invested in. So that's that person-centeredness piece of it. That's that motivational approach. We call it important to and important for. So we have to engage people in what's important to them in order to slide in that important for piece sometimes. So that was really the focus of our pilot. So we were really interested in stretching our capability to use technology. We have our own care management solution. It's currently deployed in the field on mobile devices, but we don't have the resources to make those that application really native. So it runs in a browser. It's not an optimal experience. And so that's where the partnership with iVEDiX really made sense, because their expertise is in putting that information in a native environment on a mobile device. A combination of both information that's coming from our system, but also the ability to make an extension of our system and add value to what we currently have in place. So with that, I'm going to introduce Raj Kutty, who's going to talk about iVEDiX and take it from there. Thank you.
Thanks, Scott. Appreciate it. Mic check. Okay. Slide check. Great. Thank you. You know, right off the back, I wanted to thank Scott for the great introduction. I think he's covered about 3/4 of my PowerPoint, so I'm good. Phenomenal experience so far with the Accelerator. You know, we've been extremely blessed, grateful for the introductions, for the exposure, for the guidance and the hand-holding, and not to mention the persistence. Thank you very much. You know, we also wanted to take this opportunity to thank our sponsors on NYDHA Case Management, Scott, Rochester Regional Health, Al, I'm not sure if he's here, Medisys, and other folks who have taken this window of opportunity that the Accelerator has brought us into to partner with us from a technology front and use their sort of core problems and try and bring great solutions to the front. You know, as Scott mentioned, I've spent about 20 years in big data and analytics. 4 of those years were spent with a small team, hunkered down, trying to engineer and design a product that right off the back would curate an incredibly phenomenal experience. And here's the key word, experience of interacting with data. Our first version of miVEDiX, which was the product that we launched, could not only connect to any data source, whether that's assets, traditional data sources, or social media, in real time over a mobile device, and you could get access to any part of that content personalized within an average of 2 touches. Since we launched over 18 months, we've gone through multiple capabilities, including being profile aware. So if you're a physician or a nutritionist or a dietitian or an administrator, you could get your view of the content personalized as soon as you log in. You don't have to create anything, you don't have to do anything, it's there for you. Okay. Since we launched, we've also been vetted by multiple external agencies, including former NSA agents in terms of penetration testing. We are completely HIPAA compliant and more. And we are scalable. More on the scalable part later. But one other important aspect as we roll it out to practitioners is that we can read and write back to sources. I want to talk a little bit about the trends. In 2007, there's this little thing called the iPhone that was launched. Nobody needed it, everybody wanted it, right? Since then, we may not know, but we have this subtle notion of experience that we always stick with as we use our mobile devices. When we go home, we're glued to it. When we come to work, we go back to our desktop, and we expect that to be the norm. We wanted to change that paradigm. There's a couple of different worlds that are converging. Let me give you one big fact. 15 billion, what is that? As of this year, we will have as many mobile devices as there are people on this planet. Just to give you an example, Apple sold 30,000 devices in 1 hour last year. Okay, so it's coming. You've got less than 5 years before it hits 15 billion. Okay, so what are we talking about in terms of convergence? Visualization and experience are coming together. You have to manage everything, so therefore you measure everything. So that's coming together. So analytics is becoming front and center. So everybody's talking big data. People are yet to figure out small data. That's just a reality. And so when you merge the devices and you merge analytics and you're merging visualization and all of these things coming together, you are now generating more data than you could comprehend. An average EMR has close to a petabyte of data. I didn't even know what that was 6 years ago. But it's a petabyte of data, and what that's bringing to us is that the production versus the utilization, there's a huge gap. And that's what we want to address, not just in terms of data, but also in terms of transforming that data into visualization and creating and curating a beautiful experience for the end user. Because if you can't engage the end user, then you've lost the game right off the gate. Okay. Healthcare is no different than any other vertical. Information access is incredibly painful. I think most of you know that firsthand. There's a ton of clinician frustration because there's information, but you've got to log in 17 times or go through 54 clicks before you can actually get to that piece of information. And then as a consequence, as a direct consequence, there's no shortage of applications for certain functions. But if you can't use them and the providers are not engaged, then how are you going to engage the patients? And that is a big disconnect. There's lots of ads talking about the disconnect between the physician, the provider, and the patient. And that is a big problem in healthcare. Just to give you another example, 80% of the content that people are going to expect in the next 4 years is going to be through native mobile apps. I'll just briefly go over our story. It's very simple. Since we launched 24 months ago, we've done over 100 pilots. Might be closer to 130. We've translated a lot of them into contracts and paying customers. We started off with about 100 users right off the gates. And since then, as of the end of last year, we have increased our user base to over 10,000. 70% of that are in the healthcare profile. So that's their providers. Speaking of providers, I want to give you a care provider's perspective. Fresenius Medical Care, for those of you who don't know who that group is, they're the largest dialysis group in the country and in the world. They own about 40% market share throughout, between dialysis services, clinics, medication, and other ancillary services. They came to us with some frustrations that we have been hearing time and time again as we travel through the country and talk to the providers. We are losing referrals. We're also having a big problem keeping the physicians happy. They're frustrated with their devices. They're frustrated with disengaging with their patients. They're having to tether their laptop. As cool as that was 15 years ago, it's a burden today. These are the common frustrations that they came up with. And finally, they said, we can't engage the physicians. We can't even get them to log into their EMRs. They have an entourage, a posse, who always goes around, and if they say, hey, Nate, how you doing? Nate says, oh, before he responds. That is the average engagement at the clinics. They wanted to change it for two reasons. One is they wanted to recruit and they wanted to retain their physician community, because the next generation of physicians, guarantee you they're not going to be talking about laptops. So that's where they were. As of this week, I'll tell you about what miVEDiX for the physician rounding did. As of this week, they rolled out through the App Store access to 5,000 physicians. They could actually download the app and use it for the physicians. Let me give you some core metrics. It was the most widely used adopted application that they've ever rolled out. So they were engaged. It was also had the highest usability index. Their average application index, usability index, was 64. When the application was rolled out, it was 98. So engagement was important. Ultimately, what is their objective? If you've got great experience, you've got great engagement. If you've got great engagement, you've got great quality. You know where I'm going with this. Great quality, great value, and value results in reimbursement. So there is a holistic objective. So engaging more of the physicians through a great application was significantly important, an important part of their strategy. By the way, every physician gets access to every single aspect of the data. I've just been told time's up. I knew that was going to happen. But I'm going to ask for a little bit more time. So 30,000 clinicians is what is in their roadmap, and they are going to in fact, embed it into their roadmap over the next 18 months. Okay. We're also actually handling other use cases outside clinical rounding. We've got care coordination, patient throughput, workforce optimization, public health, and clinical decision support, as Scott mentioned. So analytics comes right off the gate. We've got a great analytics engine as part of the tool set. Tons of benefits. That's an actual picture of a go-live situation where we did workforce optimization. We were doing a scheduling application dashboard real time. Why does this all matter? We're all here for a common purpose. We all want change. We all had moments of truth in our life that forced us to say we're going to do something different. The Accelerator has been a great program validation from our standpoint. We committed from a technology perspective. You have a much better perspective in terms of an industry. So us coming together, we actually have the ability for the first time in history to be able to leapfrog from where we are to where we want to be. And that was important. We have an awesome team. Marty and Amit, my colleagues are here. Amit's actually photographing me so they can make me look bad in front of my 26 other colleagues who hope I don't screw up today. In terms of funding and financing, we are in the midst of a Series B round. We're raising $7 million. We have about 50 to 60% committed already. We'd like to close that in the next 12 weeks. We have an incredibly powerful pipeline, which we want to execute on in the next 12 to 18 months. I want to focus a little bit on accelerating the product development based on the feedback that we're getting from our sponsors as well. We'll be around in the back, so if you want to see the application, by all means, seeing is believing, touching is even better. All right, thank you very much.